Good afternoon, everyone, or good morning, depending on where you're joining us from, and welcome to today's webinar, The Growth Challenges, Certification, and Sustainability of CBD in 2021 and Beyond. My name's Amy. I'm a member of the marketing team at Perry Johnson Registrars Food Safety, Inc. I'll be facilitating today's webinar and offering technical support to our speakers. Today, we're really excited to be welcoming a whole panel of industry experts for this presentation, including a couple of familiar faces from past webinars. We'll be introducing them all to you a little later on, but just before we get started, I wanted to go over a few housekeeping notes to ensure audio quality during the presentation. All of our attendees are on mute. However, we do absolutely want to take any questions you might have and get you some answers. To ask a question, you can just go ahead and type it into the questions tab of the GoToWebinar control panel on your screen, and you'll just click send. It'll come in on our end, and we'll be able to read those off and get those answers for you at the end of the presentation. Some of the most common questions we get are questions like, can I get a copy of the slides from the presentation, or will a recording be available? And yes, the slides will be available for download from the PGRFSI website, and a recording will be uploaded to our YouTube channel for review, or if we want to share the link with someone who couldn't attend the live broadcast. And now on the screen, it's just going to show you a quick screenshot of what the control panel might look like on your screen. There's a little triangle button on the left side of the questions tab. If it's not open already, you can click that triangle and expand it down to look something like this. Then you'll just go ahead and type your question in that lower box there. Whatever questions that arise, or if you just have some, a burning need to know something, go ahead and send that question over. We'll answer as many as we have time for after the slides have been completed. But now I am going to go ahead and introduce our first speaker, or the host of today's discussion, I should say, and that's Paul Demarin. He is the Senior Vice President of Food Safety and Supply Chain here at PGRFSI. Paul joined us in January of 2020 and has over 35 years of experience in the hospitality, service, and retail agri-food sectors. Paul's also a board member of the OFPA, that's the Ontario Food Protection Association, and he's an advisory council member with the George Washington University School of Business for their digital marketing certificate program. Before he came to PGRFSI, Paul worked for 17 years in the certification industry and had clients in sectors from food safety and supply chain to brand protection and quality. Paul's also worked for many years in management system certification, and prior to that, he was a professional chef and a consultant for over 20 years. So Paul, I'll hand things over to you, and you can take it away whenever you're ready.
Great, thank you, Amy. Thank you everyone for joining us today. I'm very excited to have a distinguished guest of panelists here that we're going to talk to with respect to CBD and the future of the industry. But first, before I do that, let's just jump right in, and I'd like to introduce you to our guest speakers. So if you guys could all come on screen now. Nishat is a colleague of mine that I've had the pleasure of knowing for many years. She's the president and founder of JIT Experts Hive, and they have a mission to connect innovation and knowledge and help CPG companies thrive by providing just-in-time hands-on expertise. Nishat has over 25 years of experience in the CPG industry and has a diverse and successful career working with many startups to some of the top Fortune 500 companies such as Brandless, Target, Cargill, Pillsbury, and Smuckers. She has a proven track record of delivering end-to-end expertise in a broad range of consumer packaged categories that include food, beverage, supplements, personal care, beauty, to name a few. So welcome, Nishat, and thank you for joining us. Now we're going to move on to Alan Schultes. Alan is the executive director of the GRMA, which is the Global Retailer Manufacturers Alliance, and he's charged with providing leadership and management over the certification program. Now, the GRMA is an independent certification program owner, or a CPO, and they exist solely today to advance global and safety standards within the dietary supplements, cosmetic, and over-the-counter drugs categories. As a member-based organization, the GRMA works with over 10 large US retail members, representing 50,000 brick-and-mortar locations, along with large omni-channel members. And their goal is to have a single audit system that's used by qualified certification bodies that is widely accepted and credible and will improve the overall GMP compliance and consistency across the retail landscape. Alan, thank you to you for joining as well. Now I'm going to move on to Jennifer Knack. Dr. Jen Knack is the president of compliance and science at Chief Holdings, a leader in the CBD topical and ingestible products. She obtained her PhD in pharmaceutical sciences from the University of Southern California and is a certified toxicological chemist. And after serving as a senior service fellow at the CDC and a university professor, Dr. Jen entered the cannabis industry as a cannabis testing laboratory director and now manages regulatory compliance and the development of scientifically driven hemp and CBD products. Her unique experience in science and government regulations has made her invaluable in lobbying efforts to support cannabis and hemp from a scientific perspective. And in addition to her lobbying and trade association advocacy, Dr. Jen also serves as an expert in human rights violations related to chemical terrorism and chemical exposures. Dr. Jen, thank you very much. We can't see you on camera, Jen, just so you're aware. Now I would like to introduce a colleague of mine as well, and his name is Brett McMillan. Brett has been with the Perry Johnson Companies as the division manager for 13 years. Within that time, he's worked with numerous ISO-based programs in laboratory accreditation, food safety, and information security. Brett is currently our cannabis and hemp division manager for the Perry Johnson Companies, and his duties include stakeholder representation at the state and federal level, speaking engagements, and the business development of our certification programs. In his spare time, he enjoys camping with his family, fly fishing, and off-road motorcycle racing, which I can't wait to hear maybe a little bit more. So again, everyone, thank you so much for joining. I'm really looking forward to this, and now it's going to be time for our panel discussion. So just before we do that, Jen, have you been able to get your camera working? There you go, perfect. Oh, okay, I just come off mute, Jen. So I've really been looking forward to this. Oh, thank you. If you aren't aware, you know, the cannabis industry is composed of legal cultivators and processors, producers, consumers, independent industrial standards bodies, ancillary products and services, regulators and researchers concerning the cannabis and its industry derivative hemp. The industry has been inhibited by regulatory restrictions for most of recent history, but the legal market has emerged rapidly as more governments legalize medical and adult use. Uruguay became the first country to legalize, recreational marijuana through legislation in December of 2013. And Canada became the first country to legalize private sales of recreational marijuana with Bill C-45 in 2018. So with that, today we're going to ask our panel a series of questions. I would like to just remind the panel to try and keep the responses to 2 to 3 minutes, just so that we have ample time at the end for our audience Q&A. So let's start with you, Nishad, if you don't mind. Just talk to us for a few minutes about which producers you believe are going to survive and thrive in the CBD market today and why. Oh, you're on mute, Nishad.
Okay, thank you.
Perfect.
Thank you for the webinar and this panel discussion, and it's such an honor to be on this panel with such a great group of people. In regards to your question, Paul, you know, we all know after the 2018 legalization of hemp, there was such an explosion of brands and companies who started to produce and sell CBD. The market was growing like crazy. The CBD market is still growing, but unfortunately, it has time come for some brands to get out of the business. And you know, in 2020, CBD reports from Brightfield Group showed that the U.S. market, CBD market, has experienced a significant extinction event for hundreds of small brands. And we all know that when the CBD craze came up, everybody like who had a little bit patch of a you know, land or had some, you know, were making growing hemp and then extracting CBD in their kitchen, and then they were selling it. So now things have changed. So a few things that the brands that are going to survive from now on is going to be the survival of the fittest. And which are the brands who are going to do that? One is the ones that understand their consumers. As the CBD market has grown, it has also impacted the consumers. The consumers in CBD market were always, you know, trying to self-educate, but they are becoming more savvy and discerning. So just having all this medical claims and having CBD as be-all and end-all of all the, you know, maladies and illnesses is not going to help keep the brands in business. consumers are asking. I'm working with quite a few e-commerce companies where we are creating FAQs every day. And part of it is just that they are asking questions about COA, what's on it, what does it mean, how does it compare to COAs or certificate of analysis or other places. If you're saying it's going to make me this pain go away, why? So keep in mind the companies who are prepared to educate and provide the accurate and science-backed information are going to most probably be part of the groups that are going to survive. Secondly is that access to safe and quality supply. And that's not, although, the hemp cultivation and growth exploded with the CBD, it's having access to quality, consistent supplies of the raw material is the key. And if you're a brand who have already established a good supply chain, not only that you have access to the quality supply, but have controls over your supply chain, then you have a better chance of surviving. Third one is retailer, whether the brand is a D2C and is not selling through other retailers or want to sell through other retailers. Just having the CBD products on the shelves for credible retailers, impacts everyone. And the retailers are opening up slowly but surely to selling CBD, but they have a lot of requirements from GMPs to testing to labeling. So the sooner you become brands that understand and comply and set up programs to meet those requirements are also going to survive. And then last but not least, money. Running a CBD company is, in the right way, is expensive, from testing to, compliance to, fulfillment, insurance, you name it. They need money, and banks are not very open to investing in CBD companies. So the private investors and venture capitalists are very interested. I've been involved in 2 or 3 pre-acquisition or investment due diligence, and the due diligence that investors are doing on CBD and making sure that those brands have the right programs and at least have safe and quality products are getting tighter and tighter. So there's
no, that's great, Scott. Yeah, that was a wonderful answer. I love the insight there. Alan, can you tell me a little bit more about the GRMA and the CBD task force, why it was created and how it's going? I know you gave me one slide here, so let me just flip to that and you can use that as you're discussing that.
Certainly, yeah, thank you. And I think maybe just to build on what Nishat was saying, it's challenging enough if you're in the CBD space from a manufacturing perspective. And the task force really came out of a larger roundtable meeting with manufacturers, trade organizations, consultants, accreditation bodies, regulators, certification bodies, and retailers late last year. And we opened and we started the meeting with just a pre-assessment or a survey, just asking them about some of the challenges that they were facing, and then we said, hey, what if we were to rank them? Which one would you guys like to have us help with the most? And I think probably the response was yes, please. When we asked them, are there challenges with managing the regulatory landscape and sort of the shifting regulatory landscape? Knowing what the quality system expectations are, to Nishat's point earlier, when you're needing to test, needing to establish quality practices, procedures to have a sustainable, high quality product at the end of the day. If you're moving and changing those requirements around from country to country, from state to state, from retailer to retailer, it really becomes complex for manufacturers. The other elements, and this gets into some of the supply chain or C of A, is assessing suppliers, controlling your suppliers, and then being able to sort of meet the ingredient label claims that are out there today. So that was sort of the yes, please, because all of those received a pretty consistent response from the roundtable. And so that kind of gave us the option to get to work with a number of great manufacturers retailers, labs, certification bodies, others within the industry, as we tried to develop a really balanced group of our members. And our focus was really threefold. We were looking at quality requirements. We started initially on the GMP side of things. So our certification program is covering dietary supplements, over-the-counter drug, cosmetic products through the ANSI 455 standards today. And the initial piece, because CBD had kind of been piecemealed state to state, country to country, if you will, was to look at some of the unique requirements that the states had been developing. I think we benchmarked over 10, I think it was probably closer to 15 different states and countries through the initial process to identify unique nuances that go above and beyond sort of the traditional GMP requirements that are out there today. And then to get back to sort of that core need, there are additional phases that the group is going to be focused on, looking at that supply chain best practices or requirements. What are expectations for chain of custody or C of A best practices to help out and to get back to sort of what Nishat was identifying, right from an FAQ perspective. How can you explain all of the information that's out there and help consumers make an informed decision? And then on the retailer side of things, help make sure that there's an appropriate identification for testing. Oh, thanks for showing sort of the pre-meeting survey slide. I think it kind of demonstrates just the need and the complexity that's really out there. Beyond that, right, I think those are the three core phases that the group has identified. We're just sort of entering the last part of the phase one, so the GMP assessment, where we have a draft guidance document looking at additional best practices for the categories that we covered today. So they ideally would be utilized as an assessment element for the manufacturers, for the retailers to utilize as they feel appropriate, going above and beyond the GMP expectations. So you still have a very common element across the board, but with some additional things for manufacturers and retailers to consider as appropriate.
That's great, Alan. Thank you very much. Now, Dr. Jen, why isn't CBD treated like other botanical extracts, and what additional safety and regulatory concerns do you think apply to CBD that do not maybe apply to other botanical extracts?
That's a great question, and I think it has to do partially with social stigma and racism that are embedded in the history of cannabis, but also with the plant itself and the fact that it's a phytoaccumulator. Let me start with the social stigma. You know, cannabis has at least a 2,500 year history of use. And it was even legal in the US up until the early 1900s. And that was around the time when we had the Mexico Revolution. That was about 1910. And during that time, we had a lot of immigrants coming into the US, and fear and racism fueled a lot of misinformation about THC or marijuana, and then the hemp plant in general. And because of that, hemp and marijuana became illegal, first with California, and then the rest of the country. And so there's still a great amount of misinformation out there about the plant, the things that the plant can do. As Nishat had mentioned, saying the plant can cure everything is not really true. And so we have problems right now with being able to explain what the plant can be good for, and then we're still fighting that social stigma that existed. There's also a lot of confusion about the plant and cannabinoids. So what is it that will get you high, or what is intoxicating? What is CBD, and what is it doing for health and wellness? And why do we have to have this 0.3% limit for THC? So at what point is your cannabis plant marijuana versus hemp? And so there's a lot of that misinformation and confusion that drives a lot of the problems that we have, that gave cannabis regulations that it probably didn't need. The other issue about health and safety is related to the plant itself and the fact that it's a phytoaccumulator. And phytoaccumulators are plants that are really stellar at absorbing contaminants or other adulterants from the environment around them. In fact, phytoaccumulators can be used to remediate areas that have had hazardous spills with various chemicals. And what that means in terms of cannabis is that you've got a plant that readily takes up heavy metals, pesticides, and other contaminants. And so there is a hazard that surrounds cannabis that if you grow cannabis with specific pesticides or in soil that might be good for one plant but has low levels of lead, you're going to see those contaminants show up in the plant in concentrated in the extracts and all of the downstream products made from those extracts. And that's why cannabis is required to be tested. And so that testing is not just making sure your cannabinoid concentrations are accurate and meeting label claims. It's about making sure that the plant doesn't contain concentrated pesticides, metals, aflatoxins, that it doesn't contain molds and other contaminants that could be present, including the solvents that are used for processing.
Thank you for that take, and I'm going to come back to you a little bit more on that as well. But just before I do, Brett, we're in the world of certification. So what are you seeing out there right now? How are companies approaching the various types of certifications in the CBD world?
That's a great question, Paul. So from a certification standpoint, a lot of the calls we get are, sometimes it is a larger manufacturer, a well-established company that already has a lot of procedures and things in place for a good manufacturing practices or a GMP type certificate that would lead them to a more robust association with the GRMA and that type of a checklist. But, a lot of the folks that are reaching out to us are, probably between 5 to 25 employees. They have a successful farm going for hemp. They're looking to either get good agricultural practices certification or USDA organic, or they already are teamed up or have started an extraction portion where they're creating obviously the CBD oil and those different versions. And also they may be looking for a GMP certification for that into the products that they're creating. So for instance, New York State's requiring GMP certification for anybody creating CBD products within the state. The state of Texas is requiring lab accreditation to ISO 17025 for anybody testing hemp within the state of Texas. So, even though the hemp market was, like Nishat was referring to earlier, is sort of saturated, there's a lot of farmers out there that are sitting on biomass right now that aren't even growing new crops. They're waiting to get their biomass extracted and let the commodities situation catch up with itself. But there are still a lot of companies out there that are looking to do the right thing, that want to become certified and want to go through one of those channels, so that in the bigger picture, their brand and the quality of their CBD is to the point to where they can get into big box retailers and they can get on the shelves of companies that are supporting the GRMA and other types of situations. So that's really what we're seeing on our radar right now.
Okay, that's great, Brett. Thank you very much. Jennifer, back to you then for a minute. Sorry. So, given that the landscape and regulatory landscape is changing very rapidly, what do you think are just a few of the best practices around labeling of CBD and hemp?
Yeah, labeling has been a huge problem. Every state seems to have its own regulations. So what I always recommend is, first and foremost, is follow what the FDA has set out for dietary guidelines, dietary supplement guidelines, if you're working with a consumable product. Make sure that you have that information on your label. That's critical. After that, you should know the state laws, so the states that you plan on selling into. What I'm seeing is e-commerce sales don't have too much regulatory interference at the moment. It's regulatory interference for things that are put onto a retail shelf. So you want to be sure that if your products are going onto a retail shelf, that you're being as compliant as possible. Label claims and medical claims are two separate things in this industry. And so obviously stay away from medical claims. We don't have medical claims for CBD. Stay as far away from them as possible. We have some states that believe that using the word health on a label is enough to constitute a medical claim. So be very, very careful about that. The label claims themselves for CBD, if you're making a CBD product, should be there. You should have something that says CBD, this many milligrams per container, and also milligrams per serving. If you have other cannabinoids that you're marketing, you're going to want to include some information on the label about those specific cannabinoids. Now, if you have a hemp extract and you're not calling out CBD, then probably not necessary to call out a CBD label claim, but you should have somewhere written that this is a hemp product, which leads us to putting in the definition for hemp somewhere on your label. And it sounds something along the lines of, this product is considered hemp under federal law and contains less than 0.3% delta-9 THC on a dry weight basis. This is required by a number of states, but it also makes things less confusing for regulators who walk into retail environments and start pulling things off of shelves. And I know for the big box stores, this is going to be critical for them. They don't want to have to deal with any confusion about what the product contains. You definitely want to have some level of an FDA disclaimer there that this product isn't, approved or, there to treat any condition. And that, while it's not necessary if you're not making label claims for this industry, it's been really critical because so many things have been misconstrued as medical claims. And you don't want to say that your product has 0% THC. That was a very common mistake that occurred very early on in the industry, but also still occurs to an extent. Getting a laboratory test and getting results that say the laboratory doesn't see THC doesn't mean there's no THC there, and you're leaving yourself open for lawsuit by writing that you contain 0% THC. I know of one extract in the industry right now that is free to make that claim, and they have a certification for that 0% THC, but it's not common, it's rare, and I wouldn't put it anywhere on a label. And then finally, because we have all these extra, tests that need to be run for CBD and hemp products, we want to make sure to have a QR code that leads to a website where the COA can be looked up by a batch number, or that leads directly to the COA itself. And this has been adopted from marijuana industry, and it's going to be really critical to have that to assure product safety.
Jennifer, thank you for that perspective. It's also very accurate and complete response. Thank you. Alan, the CBD task force, do you think that that's started to have an influence on the GRMA certification program? And if so, what are your thoughts?
Yeah, absolutely. I think outside of having the opportunity to work with everyone on this call, from Nishat, Brett, and Jen, and getting their inputs, their thoughts in terms of building out requirements, from that perspective, and sort of identifying, hey, here's sort of an established set of requirements that could be harmonized more broadly. I think it's the group has really done a tremendous job in creating a broader community, and I think we'll end up having a larger impact on the overall services and capabilities that we'll be able to provide back to members from a resource perspective. As manufacturers are, to Brett's point, as manufacturers are sort of going through a progression, looking to have, greater relationships with some of the larger box stores or omni-channel, being able to utilize some of the assessment tools that the group's really been working hard on to create, provide guidance on, I think is really going to have a lasting impact. And I would just add maybe to Jen's point too, outside of some of the traditional areas on labeling, the group has really spent a lot of time looking at some of the requirements around advertising or labeling requirements around, images specifically for minors, and wanting to make sure that we are doing the right thing and staying away from that, and building that in. And that's actually, I think, one of the first elements on the draft checklist today. Also, looking at some tamper evident or tamper proof packaging from that perspective, so that just in case the product gets in wrong hands, right, there isn't some sort of adverse health effect that could happen, or you're taking sort of an abundance of caution from that point of view. So I think there's a lot more community benefit outside of just sort of the specific task force initiatives that the CBD task force is having on the GRMA.
That's great. Thank you very much, Alan. Just moving forward, so we have enough time to answer all of our questions, I'd just like to ask the panel to try and leave it to about 1.5 minutes or 2 minutes at the most, just moving forward here. So Brett, what do you think, what's going on in the sales world in terms of hemp and CBD? How's the market emerging? What are you seeing?
Well, it's interesting. I'm certainly not a commodities broker, but the products are out there, and Dr. Jen can probably attest to some of this in future comments. But I still believe that even though CBD is out there, it's in social media, it's people have websites and information. I still think that the sales of CBD is still at a grassroots person-to-person level, because people get turned on to CBD by somebody they trust, or they've heard about it and they want to try it, and they want to alleviate their pets not being stressed out during fireworks over 4th of July, or a family member had a certain type of an ailment or a health issue and they firmly believe in CBD. And I think that really has started a chain reaction here into the bigger picture of the sales and what's going on in the market. In terms of the regulatory world and certifications, by far what we're seeing is definitely GMP certification. We've seen a big increase in companies that are selling hemp flower as a product for what are called cone roll or home roll cigarettes. This year by far have been, at least in my own experience, more companies getting GMP certified, including with their product list, hemp cigarettes or hemp home rolls, whatever you want to call them. From 2020 to 2021, it's easily 5 times as much as a product. Also, the tinctures also as a product. So I think the producers of these products are starting to get a little more savvy in terms of what Dr. Jen was mentioning about labeling, that you simply just can't put any claim out there. And those claims are being sustained by person to person saying, yes, this worked for me, it's a tincture, go buy the tincture. Or this dog treat worked for me, go try this certain type of a dog treat. And using 4th of July as an example, we have a pretty big family event every year for the 4th of July where there's probably 30 to 40 people and dogs running around and bottle rockets and all kinds of stuff. And there were probably 8 to 9 people when the fireworks started. They busted out their own CBD pet treat to share with everybody to try and calm down their pets. Never seen that before, but everybody had their own way of doing it. So personally, I think pet treats and or the home rolls were the biggest products and the biggest things we've seen for sales. So
that's great, Brett. Thank you very much. I can relate to a few of those as well, because we've had some members of our family that have fallen ill, and I know that they've tried that as well, and it seems to be working. So it's good to hear that. Nishat, let's move back and talk a little bit of strategy here. So for some of the companies that are online right now, what do you think are just some of the key high-level strategies that they can employ to minimize risk of regulatory action?
Well, as Dr. Jen mentioned, the first and foremost, stay away from medical claims. And not only on your labels, remember, anything associated with your company, your website, your blogs, your social media, the reviews that you post on your websites. Even if one of your customers is saying, I had this product and it cured my cancer, you put it as a review, that's your claim. So stay away from all of those, because that is the #1 triggering factor for FDA, FTC to come after companies. FDA, I shouldn't jinx it, but is staying away from enforcing, going after companies just because they're producing or selling CBD, but they are very adamant about this medical claims. Secondly is in the absence of federal regulations, do not think that's the free for all. Follow the proper GMPs. If you are doing ingestible, follow dietary supplement. If you're in cosmetic, follow the GMPs for cosmetic. As Brett mentioned, go and get those GMP certifications, even if it doesn't say, this is for CBD products or CBD is not in the scope of those products. Having those and making sure that you're following the best practices and good manufacturing practices is very important, because if you get on the radar screen by any chance and you get a visit from a regulatory agency, you don't want other cans of worms to be opened because if you look at the warning letters, it starts with those claims, but then the rest of the warning is about violations of GMPs. And again, as Dr. Jen mentioned, comply with state regulations, familiarize yourself. It's a challenging one. We understand that each state is a little bit different than the other, but minimum for the states that you have an operation in it, whether it's a farm or production or even warehouse, make sure that you have all the appropriate licenses, you have the permits, and you abide by their labeling and testing requirements. And also keep an eye for states that are the big markets for you. I mean, California recently has opened the door or is going to open the door. Before, it was illegal to sell products as CBD, as dietary supplement and food. And now with the new act, I think it's called AB 45, they're opening. So be aware and make sure that you at least comply with the state requirements for your main markets and where you have your operations.
Okay, thank you, Nishat. Dr. Jen, who out there is currently regulating the CBD, and are there any regulatory changes that you think are likely to happen in the future?
Yeah, this is very much in line with what Nishat just discussed, and it's being regulated by the states. We've all begged for a long time for the FDA to step in and regulate CBD. And right now where it stands is that CBD is a medication or an approved drug in the form of Epidiolex, and then some other, it's used to treat some rare forms of seizures in children. And there are a few more drugs that have since followed similarly. And so because of that, the FDA says that CBD cannot be a dietary supplement or in food. That having been said, as Nishat had pointed out, the FDA has come out and said that they're not focusing on stopping people from selling CBD. The way we're getting around all of this is primarily through Congress. There's a bill right now, HR 841, that would allow CBD to be added into food and into dietary supplements, but there'll be some add-ons for food and beverage, and hopefully something for pets coming at some point. And once that passes, I think we're going to see a huge explosion in sales. Brett had mentioned that CBD right now is still kind of grassroots marketing and effort to spread the word. As soon as we have some kind of regulatory framework by which to follow, I think there's going to be a huge explosion in the sales. And so you should be looking for HR 841, but also to these individual states. Nishat had mentioned AB 45 in California, and while that opens the door for a number of product types, beverages, food, dietary supplement, and pet, it also closes the door right now for inhalables in California. And so I highly recommend joining a lobby groups that will help you stay on top of these regulations as they come up, and also help to fight in those states. Texas is a good example of fighting for cannabinoids, particularly Delta-8, and making some progress there. And we can do that with CBD and hemp as well.
Thanks, Dr. Jen. Now, Nishat, you have a long executive history in the retail space as well. Are there any CBD challenges coming up in that space that you can think of or want to discuss?
As you guys know, the big retailers have been staying away from CBD for a long time. Now we see a few big retailers like Walgreens or the Vitamin Shop. They have started selling CBD products in select states. Again, they are very, very careful. And rightly so. I mean, with all the confusion that's in the industry regulatory landscape, But on top of that, state by state, it's very difficult for retailers to try to manage different regulatory compliance by state if they need to have licenses, permits, and so on. So their growth strategy in the CBD market is going to be very selective. They also need to make sure that they start partnering with trusted brands, and because they don't want to inherit issues that a bad CBD producer is going to, the issues are going to bleed into the retail. So what happens is that as the retailers open up, the first thing that they do is come up with their own requirement, especially in the absence of clear regulatory requirements. So we will see, and we've already started seeing some retailers requiring their own inspections, GMP certifications, and all that stuff. So that's very important. That puts a lot of burden on the producers and manufacturers that need to stay focused on developing and programs for safe production. It's just that a lot of their resources are going to be tied up with getting ready for, I don't know, multitudes of audits and certifications. So it's very important for organizations like GRMA to step in and bring the industry platforms, especially the retailers, because whatever retail requirement is going to cascade throughout the supply chain, and make sure that we come up with harmonized certification and standards that once audited and certified, all the retailers accept. And also it's going to be a good safety net for producers to show to the regulators that they have these standards and certifications that are credible, not just, I have so-and-so's certification, but some credible industry recognized certifications in place.
Okay, thank you, Nishat. Keeping on the same topic here, Brett, with challenges, what do you think are some of the current or future challenges that companies in the startup phase would face with respect to CBD?
So with respect to CBD, and really, obviously, the biggest acronym we've talked about is getting GMP certified. So in a startup or a company that is making a good, clean, quality product, they're usually too busy and don't have the resources for who is going to review that checklist, who is going to implement these procedures. Even though they're trying their best, who is going to be in charge of their sanitation program, who is going to vet their vendors and check those COAs on their material ingredients. So the startups, I think the challenge is making that a resource, making that an asset of managing your quality system is just as important as any other process in what you're creating and what you're making. So I think the challenges are the resources for having a good quality manager, bringing somebody in from another industry. I think another challenge that a lot of startups have had is just the documentation and the paperwork itself. Nobody gets excited about audits or paperwork, but there are a lot of software companies out there and documentation management type systems that can make it easier for a company to manage those things so that they can be successful, they can track their product, and as their company grows, then they can get into a situation like a harmonized standard with GRMA, and they can know that there's a light at the end of the tunnel that, hey, if you stay on this track with a good quality product, and keep yourself out of trouble with recalls, which hasn't really come up too much in this conversation. But when are we going to start seeing CBD recalls? For startups, you don't want to be in that situation. So I think those are the biggest challenges. Obviously, there's financial challenges, but again, I think it's resources for the quality, resources for who's going to implement those GMP procedures and practices, and then how are you going to manage those into the future when you really start selling a lot of product and you have to track these things into the future. So
right.
That's what we've seen.
Okay, well, that's good. Thank you very much for that. Alan, sorry, go ahead.
To what Brett was saying too, and I think it's what Brett's identifying is really sort of a part of a chicken and egg thing in the industry too, right? So when you're going through a certification audit, you have to have product, you have to be able to have an established sales line of sales, manufacturing stages, a number of product types, right, to be able to demonstrate conformance to the requirements. But if you're looking to establish those sales, the ability to sort of fill out the lines, be able to produce quality product at the end of the day, right? It really becomes challenging, right, to know what is the right avenue or what is the right first step. And I think that's really an important element to work with, the certification bodies on, pre-assessments, right? Because it enables an assessment of the quality system. It sort of eases the burden from needing to be able to see a number of elements in the works, and it also gives you sort of a work product. And I say I mean manufacturers, a work product that can be shared with retailers to help facilitate the conversation and talk about the elements that you are putting in place from a procedural perspective to help make sure that supply is reliable and ultimately get you to that certification that you want at the end of the day.
Yeah, I mean, in food safety, some of those issues, mislabeling, recalls, they're all, very real situations that are happening every day with companies. And sounds like it's only a matter of time before the cannabis and hemp industry start to catch up on that. And it sounds like some of that's already happening today. So Alan, just a little further then on that, I know that the task force has been very focused since its inception, but today, has there been any identified gaps with the program?
Yeah, I think we had kind of hit on a couple of them already in the conversation when it comes to labeling, nuances of labeling, state to state, because each group is a little bit different. Also, I think when you start looking country to country, there are some other unique requirements around labeling, around variants of what is put on the label that are out there. It actually came up in one of our recent conversations, and some unique requirements that are there for cosmetics, specifically on CBD, or for dietary supplements even, or nutritional products that are unique and going to be challenging because some of the category norms that are already established. So there have been some additional elements. I would say that they're traditionally above and beyond, or have a unique application or best practice that's required because of each of the states' codes and regulatory requirements. They go above and beyond the 170 something point checklist that we have today in the 455s.
Okay, no, that's great feedback. Now, I've only got about 3 minutes left before I want to move over to the audience Q&A, but Nishat, can you, again, very high level, talk about maybe some of the CBD challenges from an e-commerce perspective that you're seeing?
Yeah, CBD companies face very particular challenges when it comes to e-commerce. For example, merchant services, payment processing. I can't tell you how many e-commerce have been, the minute they started touching CBD, their credit card processors drop them, their insurance drop them, or if they stayed with them, increase the premiums significantly. The other issue is the security. So in supply chain, CBD, for many reasons, not only that they're usually higher price items, but for many other reasons, needs to be secure from theft, counterfeit products, tamper evidence. Both Jen and Alan mentioned that. Whether it's within the supply chain or during the delivery. Age verification, some states require age verification. How you manage that online? I mean, there are ways you do it, similar to selling alcohol and stuff like that, at the time of purchase, at the time of delivery. Investment and financing, we talked about it already, and the due diligence, and control over all your marketing venues. When somebody from your company is talking to a customer, or it's not their personal opinion, anything they say is the company claim. So have control over your marketing assets, whether it's a video, whether it's your website, whether it's your blog, social media. And talking about social media, there are quite a few platforms that ban any kind of advertising for CBD products, including right. Facebook. But for those who allow it, be careful about how you advertise and talk about your products.
Okay. Well, that's great. Thank you very much, Nishat. I have time for one final question here, and it's going to go to Dr. Jen. So Dr. Jen, what regulatory issues do you think should be taken into consideration when developing a new CBD or hemp extract product that is intended for nationwide distribution?
Yeah, that's it's always a challenge. I think the thing to do is to stay on top of what's going on legislatively in each state until we have some kind of federal regulation to rely on. You have to think very carefully about the type of product you're going to put out. So some states are not okay with pet products. So if you're looking for something to go nationwide, you don't want to do a pet product. Inhalables, so smokable hemp, like as Brett was discussing, is popular. So are disposable vapes, but that is a huge headache when it comes to the regulations. If you're willing to put up with that headache, there are lots of rewards to be found, but you have to think about whether you're willing to take on that challenge. There are also other things that are coming forward, like making sure that you don't exceed a certain amount of CBD or a certain amount of THC per serving. And the fact that you are to label CBD products with the amount of THC and CBD for some states. You also have to think about flavorings and whether you want your flavorings to be natural and fit into this sort of organic wellness type of product, or if you're looking for CBD for the masses and you want something artificially flavored that tastes more candy-ish, but don't market it as candy. So those are some of the things to consider before you even go forward with trying formulations on a product, making sure that what you're doing is going to meet the industry needs and that you're not going up against huge regulations that are going to make that product not viable for the long term.
Okay, that's great. Thank you. Did any of the panel have anything else to add on that? Okay. All right. Well, listen, Nishat, Alan, Brett, and Jen, thank you so much. I'm going to pass this back over to Amy to take it from here and lead us in the audience Q&A. So again, thank you very much for your time.
All right, as Paul said, thank you all so much for your input. I just wanted to really quickly, while we give our attendees some time to get any more questions in, as I said at the beginning, you can go ahead and type any questions, or if you wanted some clarification on anything that was discussed during the panel, go ahead and get that typed into the questions tab on the GoToWebinar control panel, and we will get to those in just a minute. But really quick, I just wanted to show you two of our upcoming webinars that we have in the next couple of weeks. These are all free to register for at pagerfsi.com/webinars, and we would love to see you all on one of those broadcasts. But now I'm going to go ahead and open the questions tab and see what we've got here. All right, let's see. Okay, we've got a question here from Stony, or more of a statement, and we can kind of phrase it as a question. I would angle this one towards Jen. Stony says, in West Virginia, we're defining quote unquote non-detectable as a hemp-derived ingredient or product that does not contain levels of a cannabinoid above 10 parts per million. So a potency test verifying this information must be submitted to make the quote unquote THC free claim. Any thoughts on this, Jen, or any other states that you know of doing something similar?
Yeah, so this is a very good point. There are some states that have actually specified at what percentage you can, or what limit you can say that you don't have THC in your product. There aren't many of them, and I don't know of more than 2 or 3. And so if you want your product to go just in West Virginia, certainly you can write a 0% THC there. I think you're protected by law. I'm not a lawyer, so definitely seek out legal advice officially for that in your state. But the vast majority of states, unfortunately, do not consider 0% THC to be not detect from a COA. And you'll notice as you get more involved in the industry that different laboratories have different levels of sensitivity for cannabinoids. And so while you may have one laboratory that can detect up to 0.3% THC or can detect that level in your product, they don't go much below that. And they might tell you you have no THC, and then you may find out from another lab that that product actually has 0.29% THC. And so there's no good definition now. And I think just in general, the best recommendation is to just not write THC free or 0% THC unless you know specifically where that product is going so that you're protected under that state's laws.
All right, great. Thank you, Jen. Anyone else on the panel have input on this? And just as a disclaimer, if anyone has any input and wants to expand on the conversation, I'm going to try and direct some of these questions unless they have a specific person named. I'm just going to direct them to who I think might be able to best answer, but feel free to offer input whenever. All right, we've got a question here from Carlos, and Nishat, I think this one is up your alley. Carlos is asking, is CBD considered a food or a dietary supplement? What certification should a company be registered for, and should the facility be registered for food or dietary supplements?
Well, neither by federal law, and because CBD has been approved as an drug, active ingredient by law, and that's the whole issue with FDA. FDA hasn't approved it to be used in food and dietary supplement. Having said that, I think maybe Brett can be better respond to this question. As we mentioned, if you are marketing your product as a food or dietary supplement, make sure that, as Jen and Brett said, follow the labeling, follow the GMPs appropriate to the product category you are marketing it for. Brett, Jen, do you want to add anything to that?
We're certainly not in the position to dictate how the CBD is categorized, but what I can tell you is that certain manufacturers are requesting certain types of certifications so they can say that, for instance, a certain CFR code like CFR 111 or 117 to say that they're, covered as a dietary supplement. So, we can certify to those things, but it's a slippery slope to, to try and put CBD in one of those categories. And I'm certainly not going to proclaim that it's any one of those things. I think it does work as a dietary supplement personally. I think it does work in a cosmetic. I think it can work as a food. So it's it's sort of a conundrum, if you will. Who is to say which silo it goes in? And that could be a whole nother webinar that could be debated all day. So I will, I'll pass the torch over to Dr. Jen for her comments on that too, to get it off my plate. But that's my opinion.
I have to step out for a moment. I'm just kidding.
There you go.
I generally recommend, getting that GMP certification. I do like the ISO 9001 for manufacturing. CBD is in there's a very fine line here between the food and the dietary supplements, since, as Nishat has pointed out, we're just neither really. There are some states and some areas or counties in each state that require you to have food licenses and to be able to show your food license. And, me being based in California, that's come up as an issue in certain regions that, California doesn't approve CBD in food. You can't get a food license. Therefore, you cannot sell CBD if it's going to be an edible. So like a tincture or, a gummy, you cannot sell in that region. So that is common. I just always say GMP to start and then ISO after that. Make sure you're doing things as well as possible, because right now neither of those are even required by the industry as a whole. So those are the things that give you that leg up and that help to assure your customers and consumers that your product is safe and it's being made well.
All right, perfect. Thank you for that added context, Jen. It actually touches on the next question that we got from Miranda. And Brett, I'm sure you can help with this one, because it, as Jen mentioned, it's regarding ISO 9 for cannabis, THC, CBD products. How can something that's not geared specifically towards food or supplements be beneficial?
You mean the CBD? You mean the CBD product, or how was the question?
The question is that Miranda saying, I've seen ISO 9 promoted as an option, a certification option for those producing CBD or cannabis products. How is it? How is it helpful? You know,
So, okay, yeah, that's a good question. So basically, ISO 9001 is the baseline, most globally recognized quality certification that any kind of company can get. You don't have to be in the CBD world. You can be a metal stamping plant for GM. You can be a CBD manufacturer. You can be making apple juice. And ISO 9001 is more document what you do and do what you document. And it focuses on the quality processes at your company, management reviews, vetting vendors, things like that. ISO 9001 is not going to get into what is your sanitation schedule. ISO 9001 is not going to get into how are you handling allergens. ISO 9001 may not get into how would you handle a recall. But on the flip side, GMP certification is not going to get into when's the last time you had a management review, or when is the last time you reviewed any customer complaints, or how you vet certain types of vendors. So like Dr. Jen mentioned earlier, having ISO 9001 in place with GMP is a very powerful combination because they both complement each other. And together, I think that's the most solid situation you can be in until your company gets to a point to be under the umbrella of a harmonized certification like what the GRMA is doing right now, which would take it even a step further. Would you agree, Dr. Jen, from your previous experiences, or?
Yeah, the GMP is telling you that yes, you can eat the product and you're not going to get sick from it, or things have been done to make sure you're not going to get sick from the process or from the product. The ISO 9001 is telling you that if a problem happens, you are addressing it. If a customer has a complaint, that's being addressed. You have a full company that is all geared towards certain goals and reviewing data and information to make sure they're doing the best that they possibly can. It's an added level that shows that you care about what you're putting out and that you care about your company and your company doing better. And so it is that continuous improvement cycle. It's not to say that a company without ISO 9001 is not doing a good job. It's just to say that they don't necessarily have the rigorous quality assurance in place that you would find at one of these certified companies. And so it really is kind of giving that complete package for your company.
absolutely, covering all the bases. All right, I'm going to squeeze in one more question here since we did get one that's addressed to Alan, and that one is from Jeremy. Jeremy's asking Alan, what are your thoughts on the ISO workgroup's activities with CBD and cannabis?
Yeah, I think similar to the GRMA task force, granted ISO is on a completely different level, right? There's I think a strong desire more globally to have some harmonized requirements because of the challenges that are out there. So I think with the technical guidance documents and the work group that they've been working on, certainly there's a number of countries, really reputable experts throughout, helping to build out some of those. We had a preliminary review and understanding of everything that was happening within the ISO work group get presented back to the task force as we've been kind of working on the guidance document for GMPs. And I really hope that there's something that comes out and can be published out of all the work, and there's sort of a broader recognition and ability to utilize that amongst the industry, because it's really I think an important need based on the questions that we're seeing here, and then also based on the feedback that we've received to help create the task force for us.
Absolutely. Any other input from our panel before we wrap things up? We've reached the end of our allotted time, so I don't want to keep the audience too long. No? Any parting words of wisdom as we go into 2022?
I just want to say, like, the cannabis plant is fantastic. I believe, we talk a lot about CBD, but I encourage everyone to get to know the plant itself. There are so many amazing things inside of the plant that should be considered, aside from cannabinoids, which also include terpenes and flavonoids. And I think that it would be worthwhile to keep those in mind as you move forward in this industry.
Thanks so much, Jen. Well, thank you to all of our panel members for taking the time out of your day to come and participate in this session and answer all these questions. We absolutely appreciate it. We also appreciate our audience for taking the time to tune in and get some new info, especially to those who did ask questions. Thank you so much. If maybe you missed a part of the broadcast or you wanted to review, the recording should be up on our YouTube channel in the next day or so. The slides will also be available from our website, as I stated at the beginning. But I'm going to go ahead and wrap things up for today, and we hope to see you all on a future webinar. Thanks all, and have a great rest of your week.
Thank you, everyone.
Thank you.